Hello guys, so now we shall be discussing regarding the hypoglossal nerve, which is also called as a motor nerve, right? And it is cranial nerve number 12. So our topic of discussion would be regarding the hypoglossal nerve. Hypoglossal nerve, right? So this is your cranial nerve number 12. Now this hypoglossal nerve is purely motor nerve. It is purely your motor nerve. So what is the course of this hypoglossal nerve we shall discuss right now, but before that let me draw that this hypoglossal nerve starts from your medulla oblongata. So let me draw the structures of the medulla oblongata over here. So this is your medulla oblongata, and all of you should know that here you have got a structure like this. This is called as your inferior cerebellar peduncle. And next important thing is that here you have got olive. So this particular structure which I am drawing with the beaded appearance, this is called as your olives. Okay. So this one over here is called as your inferior cerebellar peduncle. And this particular structure over here is called as your olives. Okay. Right. Next important thing is that just side to the olives, this particular structure which you can see over here is called as pyramid. This particular structure over here is called as your pyramid. So one is called as your olive and the other one is called as your pyramid. Next important thing is that here you have got an foramen. This foramen over here is called as your hypoglossal canal. Okay, what is this canal? This is called as your hypoglossal canal. Next, down here you have got that this is your common carotid artery. Okay, this common carotid artery is having this particular structure. This is called as your internal carotid artery. Now this internal carotid artery is having a swelling over here, and this is called as your external carotid artery. So one is your internal carotid artery which has got a swelling, and the other one is called as your external carotid artery. This swelling over here to the internal carotid artery is called as carotid sinus. Okay. Now anteriorly, if you see, you know that this is your tongue. Anteriorly here you have got your tongue line. Okay. So here you have got your tongue, and let us say this is your tooth all the way. Now this is a section from the lateral side, right? So this part, whatever is there with the teeth attached, that is a thing I have drawn over here. So this is the teeth, right? And this is the remaining part of the cavity. And down here, you know, you have got your hyoid bone. This is your hyoid bone on the down. And side here you have got a process called as your styloid process. So let me write down these structures. So here this is called as your tongue. This is called as your styloid process. Styloid process, and this is called as your hyoid bone. This is called as your hyoid bone. Okay. Now here one very important thing you need to know, that from this part over here till here, right? So this muscle which you can see over here, the name of this muscle is called as genioglossus muscle. Okay. What is this muscle? This muscle is called as your genioglossus muscle. So this particular muscle which you can see over here is called as genioglossus muscle. Now after this genioglossus muscle, here you have got another muscle like this, right? So this particular muscle is called as your hyoglossus muscle. This particular muscle over here is called as hyoglossus muscle. Next, from the styloid process, you see this muscle that is coming. So this muscle over here is called as your styloglossus muscle. So this particular muscle over here is called as your styloglossus muscle. Okay, so this particular muscle over here is called as your styloglossus muscle. So let me write down the names of this muscle. This one is called as your styloglossus, and this is called as your genioglossus, right? And this is called as your hyoglossus. So there are three important muscles. One is called as your styloglossus, genioglossus, as well as your hyoglossus muscle. Now Let us start discussing this. First of all, we have to draw down the nuclei before we discuss all these things, right? So the first important thing, the nuclei which we draw within the medulla, this nucleus is called as your hypoglossal nucleus. What is the name of this nucleus? This nucleus is called as your hypoglossal nucleus. Hypoglossal nucleus. Okay. Now from this particular hypoglossal nucleus, you see a nerve that is coming out. This nerve is called as your hypoglossal nerve. Now from where does this nerve descend? This hypoglossal nerve, let me draw this nerve with the blue. This hypoglossal nerve descends between the olives and the pyramid. You see, it is descending in between the olives and the pyramid, and then it passes into your canal. This canal is called as what? This canal is called as hypoglossal canal. So this canal is called as hypoglossal canal, and this one over here is called as your external carotid artery. This is called as your internal carotid artery. Okay, so this passes from the hypoglossal canal, comes down all the way. Now after coming down all the way, this passes, this hypoglossal nerve, right? It passes above your internal carotid artery and below your external carotid artery. It passes above your internal carotid and below your external carotid artery. Now after passing, then slowly this nerve will enter into the muscles here, and it would supply three muscles. One muscle it would supply is your Hyoglossus muscle. Second is it would supply your Styloglossus, and the third one it would supply is your Genioglossus. So it is supplying three important muscles. One is called as Hyoglossus, Styloglossus, and the next important one is called as the Genioglossus muscle. Okay. Now where is this hypoglossal nerve located? The hypoglossal nerve is located lateral to a structure over here. This is called as your vertebral artery. What is this? This is called as vertebral artery. It is located lateral to the vertebral artery. Next, from your C1 segment, of your spinal cord, right, you see some nerves that are coming out. For example, first important thing is that from your C1 segment of your spinal nerves, you see a nerve that is coming up and it is entering into this hypoglossal canal and coming out, right? So this nerve is giving out a branch, and this branch is called as meningeal branch. This is called as your meningeal branch over here. In the same way, next important nerve is that this another nerve also comes out of C1, right? Another nerve also comes out of C1, and this forms a superior root of Ansa cervicalis. You know, there is a structure in the cervical plexus which we study that is called as Ansa cervicalis. Ansa cervicalis is formed by two roots. One is called as a superior root like this, another one is called as the inferior root like this. So totally you see a circle that is formed here. This is called as an Ansa cervicalis. So C1 segment gives contribution to your superior root of Ansa cervicalis. Superior root of Ansa cervicalis. Superior root of Ansa cervicalis. Now after giving superior root of Ansa cervicalis, what does it do? This goes all the way down to the external carotid, behind the external carotid, and it enters into the muscles. Before entering into the muscles, first of all, you should know few important ligaments over here. What are these important ligaments? For example, let us say that there is an important ligament that is connecting all the way till the hyoid bone. This ligament is called as geniohyoid ligament. What is this? This is called as geniohyoid ligament. In the same way, you even have got a ligament beneath the hyoid bone. This is called as, what is this ligament called? This ligament is called as thyrohyoid ligament. Okay, beneath the hyoid bone you have got thyroid cartilage. So attached to the thyroid cartilage you see a ligament. This is called as thyrohyoid ligament or thyrohyoid membrane. Okay, so this one over here is called as geniohyoid membrane, and this one over here is called as thyrohyoid membrane. Okay, and what is actually happening over here? What is actually happening is that this particular nerve from the C1, right, it goes all the way, does not supply any of the muscles, rather it will go and innervate your this particular structure called as geniohyoid. At the same time, it would also innervate your thyrohyoid. Okay, so these are all the important things which you need to know over here, right? So this is all you need to know regarding the hypoglossal nerve, guys. So thank you so much for watching my video. Goodbye.